For this new mother, the birth of her baby should have been a moment of joy. But she gave birth during the DRC's worst Ebola outbreak to date, a time when many other people are avoiding medical centres. She says the memory of the birth will stay with her, but so too will the emotional trauma of the day she was born.
It was really stressful because I was in a clinic near the Ebola treatment center. Even when the nurses and midwives came to see us, it sometimes traumatized me. We had also witnessed many Ebola-related deaths. I thought to myself, Lord, I don't want to risk catching this disease.
Officials say the fear of Ebola is keeping people from seeking healthcare, and missed prenatal appointments are on the rise, a trend that brings further danger with it.
When women miss appointments, it becomes difficult to know in time if the fetus has a problem. We can sometimes detect these complications before they become serious. But when women stay at home for fear of infection, we see more complications, including stillbirth and premature birth.
The UN says more than 7.5 million people have been affected by the outbreak's secondary impact on health systems and essential services. The UN deputy spokesperson says the use of health services in the hardest hit areas has dropped by more than 40%. In Ituri province, the UN also says deaths from birth-related complications have doubled to about 6 per week. The outbreak, caused by the Bundibujo strain of Ebola virus, for which there is no vaccine, has now spread to 6 provinces. And health workers trying to contain it are facing their own challenges. Some have gone on strike due to unpaid wages, disrupting contact tracing.
Several healthcare facilities were closed for a period of time. We too were closed for 21 days. Healthcare staff were quarantined to ensure that no one showed any signs of the disease, and thus prevent any potential contamination of patients. Then we disinfected the entire facility before reopening it to patients.
There is, however, some hope on the horizon. The World Health Organization says 2 vaccines specifically designed against this strain have now entered early-stage human trials. But for new mothers, the immediate challenge is much more basic: finding the confidence to seek care during this current crisis. Cara, Legg, Al Jazeera.